Hello and welcome back to the Harmony Inspired Health podcast. Today, I am honored to welcome a special guest whose journey is not only deeply personal, but also profoundly transformational. Dr. Shane, the founder of SunMed at Noosa and co-founder of Not Another Rehab and the Way of the Wellness Mentorship program. Shane's path into Eastern medicine was born from his own struggles with mental health and addiction. Disillusioned by conventional approaches, he turned towards personal training, remedial therapies, and eventually ancient Eastern systems like shiatsu and tuina. That exploration led him into decades of study and devotion, including a bachelor's degree in Chinese medicine and acupuncture, postgrad training in traditional Japanese acupuncture, and a master's in Chinese herbal medicine. And when I was going through my training as well, Shane was one of my mentors. So I'm very excited to have him here with us today. He's also immersed in Qigong, Tai Chi, and meditation, training under the Chen family lineage and embodying what he teaches in both his clinical practice and mentorship work. So whether you're a practitioner, someone navigating burnout, or just looking to reclaim your mind-body balance, this episode will meet you where you're at. So let's dive in. But first, I want to give you a warm welcome, Shane. Thanks so much for being here today.
Thank you for having me, Harmony.
It's my pleasure. I was going to say it's your pleasure. No, it is my pleasure. Well, let's begin with your personal journey. What was the turning point in your life that drew you towards healing and more specifically towards Eastern medicine?
Yeah, it's a great question. So it started with drug addiction, and then through drug addiction, a lot of mental health issues. I won't delve too deep into it because it gets quite dark, but there's like psychosis and depression and suicide and all those sorts of things involved. And basically I had voices in my head that I couldn't control. And I went through all the conventional approaches, psychotherapy, psychology, psychiatry. I didn't want to be medicated because I didn't want to go down that path. I didn't want to replace drugs with drugs. And I always knew that there'd be a way out of it. And I knew I could do it inside of me. I just didn't know how. And then so I actually, in a manic episode, I was screaming in my car, I need help. Like, I need a sign from God, give me a sign, something like that. And an ad came on the radio and it said, become a personal trainer in 6 weeks. And I was like, that's it. That's my sign.
Sign, personal
And so, if anyone ever doubts the power of marketing, it saved my life. So I went off and became a personal trainer, and I fell in love with the human body. And I had a couple of great teachers in there that really saw something in me, and they told me, that they saw something in me, and that really motivated and helped me want to do more. And so from there, I went on and studied remedial massage. Still didn't know what I wanted to do at this age. So I was like 23, and my brother was actually going to prison, and he gave me a book on Chinese medicine and drug addiction. And I read that and I was like, there's my answers. And that was in 2006 or 7 that happened. And yeah, ever since then, I've been in Eastern medicine. You'll never get me out of it.
Must have been such a bizarre time when you were like as you said, manic episode and fueling your health with like drugs. And then you go and do personal training and you're learning all about the body and health and working out. How did that? I'm just trying to get in my head around like how you made that quick switch. Like, were you like
It wasn't
coming?
a quick switch. It wasn't
It
a quick
wasn't. Okay.
So I'd already been trying to figure out how I was going to do this for years. So I'd been clean for about 2 or 3 years, but I was still really, really unstable mentally.
Sure.
So the drugs had left me with a permanent psychosis.
Right.
And so I was in that state all the time, but I wasn't using drugs because I knew if I did, I was going to end up institutionalized. And that was the last thing I wanted to do. Was either I was going to end up dead, in jail, or in an institution. And it's just not what I wanted. And so I'd been soberish. I wouldn't say I was sober, but I'd been soberish for a couple of years. So yeah, it wasn't a quick turnaround. It was a very slow turnaround over a few years.
Yeah. Well, it's amazing that you had that insight all the way through that experience anyway. Like that's wonderful that you did have that insight. So how did your early experiences with mental health and addiction shape the way that you view health now as yourself now?
Well, that's a deep question.
Well, we like to go deep.
The Eastern perspective on the mind is completely different
Hmm.
to the Western perspective of the mind. And so where everything gets pathologized in Eastern medicine, it's like Western medicine, sorry, and Western language, I should say. And it's put into a box of this is that, and this is that, and this is that. Whereas in Eastern medicine, when you have these things, you can't separate it, one, from the body. And then they question, well, what is even the mind? Where is the mind? And, and if you go into like the Buddhist and the Vedic traditions and you have a psychosis, they're like, congratulations, you just figured out who you are,
Mm.
because the mind is in a constant flux of chaos. And so essentially it's just bringing awareness to who you already are. And then it's about training that to come into a more harmonized state.
And you said essentially the book that your brother gave you, I guess, saved you in a way. Was there something specific in that book that really hit home for you? Or
Yeah.
was it? Yeah.
Yeah. There was one particular line. It was something around the lines of, I was never going to be as happy as what I was on drugs, but I knew if I went back to them, it wasn't going to end well. And if but there was a way out of it.
Yeah.
You can be happy again without the drugs. And
Yeah.
that was what really hit home for me, was knowing that someone else had been through something similar where they'd done a lot of drugs and experienced the massive highs and then couldn't get back to those highs or even a base level of happiness without using drugs.
You're
And
right.
then that was for me, the realization is like, oh, you can actually get back there.
You're right. And in your practice now as a doctor of Chinese medicine acupuncturist, you do support other people with addiction. So what's the role that TCM and acupuncture play in addiction? How are they helping to cure people from the addiction?
Yeah. So from a like even just like looking at a neuroscience point of view of how acupuncture actually even works. And so we're working on enkephalins and the endogenous opioids. You can work on the endogenous cannabinoid system. So you can actually trigger off the same endogenous drugs that actually, say, smoking weed or heroin or meth actually triggers off in the system. So that's one part of it. The other part of it is that it helps to basically regulate the system, regulate the nervous system. So instead of being like a person feeling triggered or feeling like cravings, it can help to downregulate all of that sort of stuff. From the Western point of view, the Eastern point of view, I want to get those mixed up a lot. So from the Eastern point of view, you've got the working with the body's chi. And so when a person has a drug experience, that is a free flow of chi. And so it works on restoring the free flow of chi back through the body. And so that's it at a really simplistic level. It's a bit more complicated than that. And then like working with it in clinic is a lot of people don't even realize what they're coming in for is actually partly an addiction. And so for instance, like the part of the brain for addiction is the same part that registers pain and pleasure. And so if a person comes in pain, they're actually the part of their brain that's registering that pain and is affecting that, whether it be a sore shoulder or a sore back, is actually the same part of the brain that says, hey, you have an addiction. And so it helps to regulate the pain receptors in the body, helps the body to bring those back into a balanced state.
Yeah. Yeah. And I guess also having been through it yourself, I know like you're quite compassionate with your clients as well. And I think what people don't realize when they come to get, like, say, an acupuncture treatment, for instance, the practitioner gives so much more than just sticking needles in, right? And activating some of those senses. There's sort of it's not like you're counseling them or anything, but there's sort of that wisdom that's worked through the hands of the practitioner, but also through, talking to them while they're on the table, or, just being that sort of person that they feel safe in. Because I'm assuming that a lot of people who suffer with addiction, there's a part of them that they don't feel safe in who they are. That's why maybe they are turning to alternatives. And so being that person for someone could be really supportive as well for you. And I know when I was in your clinic, we were speaking about your program that you were going to be bringing out, and you have now not another rehab program. So, what is not another rehab program? What does that mean?
It's the space between rehab and recovery.
Yeah, right. Okay.
Basically, I've got a real big stick up my butt about the standard rehab approach and demonizing drugs, and that drugs are the problem, and that once you stop drugs, the problems go away.
Mhm.
Once you stop drugs, the problems don't go away. If anything, they probably get worse. And so the number one thing that we do is we don't demonize the drugs. So we don't blame the drugs. We're all about basically radical acceptance and radical self-responsibility.
Yeah.
Yeah. So it's like taking responsibility for our role in the whole process. And so where we're different from other rehabilitation clinics is we're not about sobriety. We're not about abstinence. We're about taking responsibility for your actions. And so teaching people other tools and mechanisms that they can use that will actually help them in the recovery state. And our catchphrase is life beyond recovery, because the whole thing is that you only need to be in recovery for about 12 months in the reality of things. Yeah. What you need is actually the tools to actually continue on after that. And the tools that we give, like Qigong, like Tai Chi, like meditation, like yoga, like breath work, that actually allow the person to experience the same states that they experience on drugs without the drugs. And when people can live a life like that, they don't want to do drugs. And then they
Mm.
realize that the drugs were never the cause of their problems, they were. And so it allows people to take the power back from blaming drugs, blaming trauma, blaming all the other things that have caught on in the recovery systems. They are not the root causes. The root cause is that we don't know who we are anymore. And when we can take responsibility for who we are, dark and light, then we can actually become a whole human being again, and we can actually live a life beyond recovery.
Yeah. Beautiful. I love that. They're getting high on their own chi and prana and learning how to do that.
Breaks the rules of drug dealing. You can get high off your own supply.
Yay. That's amazing. And it's free, right?
Totally free.
Amazing. So, what kind of results are you seeing when people begin to treat the root of their energetic patterns? You said, like, I guess you were talking about their problems weren't the drugs, it became before the drugs. So,
Yes.
how do we sort of get to those? And what are you seeing when they're treating the root of the energetic patterns rather than just the symptoms alone?
It's a whole transformation. Yeah, you can't, there's no specific change. The person as a whole completely changes. Their outlook on life changes, their mindset changes, their perspective on all the bad stuff that's happened to them changes, because you're able to see the whole picture instead of just looking at everything that's wrong and looking at a cause. You know, I don't actually, when I say a root cause, and I say the root cause is not knowing who we are, that's like a disconnection from our higher self or God, or however a person wants to call it. There's no right or wrong answer to that. That's the same root cause for everything. Everything outside of that is a web of dysfunction. And so I always look at, like, there's so many possibilities that there could be on this web of dysfunction, that it's about, like, when you heal something over here, it opens up something over here. So then you start moving over here, and then it's there, and then, all these different things pop up along the way. And the beautiful thing about Eastern medicine is it looks at patterns.
Yeah.
And so we're treating patterns, and those patterns are constantly evolving. And it's taking a person from a pattern of disharmony into a pattern of harmony. And then when they're in that pattern of harmony, and then they realize that the root cause is that disconnection from self, it doesn't matter how you get there. Does that make sense?
Yeah, absolutely. Yeah, I totally agree. I'm hearing exactly what you're saying. And that's even like at the core of my work. Like I've come up with these pillars. Treat hormonal health, like women's health, a little bit different to addiction. But, at the core of it, they're feeling disconnected from self a lot of the time when they're going through this transition from perimenopause to menopause. And my whole methodology is called the higher self method because it's how to get back to that deeper connection. Because you'll find when you get back to that deeper connection, you will feel so much better within yourself, which lowers the stress, the stress hormone response, which allows you to come into more santosha, which is contentment with where you're at in life. And yeah, I definitely understand. And that's what I love so much about Eastern medicine. It's not just about like herbs and acupuncture needles and diet protocols. It's a philosophy within itself as well as an art and a science. And when you bring all that together, you're getting like the best out of medicine, and it's so individualized. So I really resonate with what you're saying. And I love that you're giving them so many tools that, you know, they would have never been exposed to. And I'm sure you're weaving in all of that Eastern philosophy as well, because that's sort of, I guess, almost the core of it, isn't it? Like,
Yeah, 100%. I really love what you just said then, because it hits home really well that it's just like a hormonal issue for women is no different than a person with addiction, because everyone across the path, and this is what's given me so much compassion in clinic, was when I opened Sun Med, and I'd come from basically just spending 15 years just treating drug addicts and thinking that clinic's going to be so much easier than just treating drug addicts. And then what I realized that everyone actually has the same issue, whether they're a drug addict or not. And whether it's like a hormonal imbalance, whether it's pain or digestive issue, whatever it is, everyone at the root cause still has the same issue. And that's that disconnection from self. And coming into like everyday clinic has basic from just exclusively in drug rehabs made me realize, wow, everyone is suffering,
yeah.
everyone. And it's the same reason for the suffering. And it's just wild. And I love that you're doing, and you see that too in your clinic. It's beautiful.
And it's ultimately the reason that we're here, right? We're here to evolve into a higher self. We were born to forget, and then the whole game of life is to remember.
Yeah,
And
yeah,
so that's what we're really doing.
yeah, exactly.
Yeah, and taking different paths. And so what's the wellness mentorship that you've got as well? Is that something different completely?
It's it's basically the program that I designed to work with drug addiction in the first place. And then basically like so it's body, mind, energy. There's 12 things off that. So I won't go into all of them, but things like breath work, nutrition, rest, sleep, all the tools that we talk about. But we also go into things like lifestyle, and we go into the environment. And so looking at the environment from an Eastern medicine perspective and lifestyle from an Eastern medicine perspective as well, which includes like circadian rhythm stuff and things that are becoming much more popularized, that we've been in Eastern medicine for thousands of years, and it's
Yeah.
just sort of re-coming back to the surface.
It's now called biohacking.
Biohacking, yeah. Whereas it should just be called life.
Yeah. Living life how you meant to.
Yeah. So that program I actually created for working with drug addicts, and it was really powerful in that. And then I started using it with just my everyday patients, and oh my God, it worked for them too.
Who would have known?
Yeah, exactly. And so it's basically, yeah, just the three pillars: body, mind, and energy, and then lifestyle, and then environment. And then how the underlying core philosophy of it is that you've got your Eastern medicine with your psychology and your sciences. So I don't like to sort of like polarize in the sense of the language of it. I will talk to people about the brain and how the dopamine and serotonin and all that sort of stuff works. I'm not a neuroscientist by any means, but I do understand it because I've studied like the biology of addiction to the 10th degree. And so it's all included in there. And so just understanding how the brain works, how the body works in that sense, and then where they all meet. So Eastern medicine and neuroscience meet in the quantum scientists, and it's like it's really coming to a field now how actually close they are to like talking about what they talk about in like the esoteric philosophies of the East. The quantum scientists are really sort of touching on that stuff now. Science and psychology is neuroscience and how the brain works, and then Eastern medicine and psychology meet in mindfulness. And the peak of psychology now is teaching people to be mindful.
Mm.
And
So
then where all three of them actually meet is in flow states of consciousness. And, you know, the peak of neuroscience is flow consciousness. The peak of mindfulness is flow consciousness. The peak of quantum is the flow of life. And so when people take drugs or they have a really good experience in life, they feel in flow with everything. And so it's about coming back to that center of flow. And then once we're in that center of flow, we can literally just surrender to the current and off we go.
yeah, beautiful. I have a question now for the practitioners because a lot of my listeners are practitioners themselves in some sort of healing modality. And I know that you run a very busy clinic and you give a lot of yourself to all of your clients. So, what advice would you give to health professionals who are feeling depleted or disconnected from their own energy? Because I know how, like, the job is so beautifully rewarding, but it can also be very exhausting if you don't have those sort of boundaries up, those energetic boundaries.
Suffered dearly with this. Compassion fatigue is a real thing. It's not made up. Burnout is real. Sorry, there's just a truck driving past at the moment. It's very loud. You have to have a practice, and it has to be a grounded, solid practice. It can't be, I mean, you can do it. I shouldn't say you can't. You can do it with like dousing yourself in white light and all that sort of stuff. But there's only so much that will do. You have to have a really ground up, in my experience, and I've dealt with some really heavy people. You have to have from a ground up base. And for me, that was Tai Chi. Like I used to, so I'll give you some examples of what used to happen to me working in clinic. So I've literally been attacked by entities. So like woken up in my dreams, wrapped up in bed sheets because of like, this is the level of dark stuff that you work with in rehabs, and, you know, attacked in my dream state and like waking up in panic. I've had all sorts of wild experiences like that. I could literally talk about it for hours. When I started learning Tai Chi, it stopped. And I was like, I couldn't figure out why. But from a Chinese medicine perspective, it's because it builds up your Wei Qi, it builds your defense systems. And so it builds up your field, but it doesn't build it up in the sense of like, oh, I'm just protecting myself out here. It comes from your center. And so when you're immovable from your center, nothing can get in. And like one, for instance, like, so I train, you mentioned in the introduction, I train with the Chen family. So I was in China training with under the Chen lineage and was walking around with the master, and there's all these little like signs like around and like of this guy with like swords and stuff. I was like, oh, I asked him, what are they about? And he's like, oh, protecting people from ghosts. And he looks at me and he goes, but we don't need it.
We got way cheap.
Yeah. And so like when I really understood that, I was like, oh, that's why all of that really weird stuff stopped happening to me, because I've developed that from the inside to the outside instead of just like sort of like, oh, I'm protected by white light, or, you know, I'm just going to say a little prayer, but it actually comes from your core. So nothing can penetrate in. And for me, having a daily practice like that allows me to spend more time, listen to more things, hear some pretty severe problems, and know that they're not me. And so that was something else really important that I learned early on, was being able to differentiate between what's yours and what's someone else's.
Mm.
You may walk into clinic and go, I feel fantastic today. And then you see your first patient of the day and you feel completely different. And it's not you, it's actually them. And so being able to discern what's yours and what's not yours. And again, Tai Chi, Qigong, good yoga practice, good meditation practices that teach you to utilize from your center allows you to discern that so that you're not taking on other people's problems. And one of my big things, if I find myself thinking about someone after work or after I'm finished with them, I'm like, oh, they're still with me. And I'm like, see you later.
Yeah. I think that's so relevant, even if you're not a practitioner, because we take on so many different people, especially as empaths, you take on so many different people's problems that aren't yours to carry. And it definitely does weigh you down. Like I've experienced that recently, actually. And it is hard to shake it off sometimes. But when you have to remind yourself, like, why am I carrying someone else's like heaviness? Doesn't need to be that way. So I think, yeah, just having that realization, it's not even just practitioners, but certainly we do need to protect ourselves. So yeah, that was good. So as this whole conversation, I knew it was going to be a good, deep, juicy one. We we always had great combos when I was up there for my prac as well. So miss
Yeah,
those.
I don't do small talk, Harmony. You should know that.
I know that. I know, and I absolutely love it. So, yeah, thank you so much for being so open and everything you've shared with us. If there is any listeners that want to get in contact with you, either for themselves or if they like inquiring on behalf of someone else, I know you don't love that because the person has to be responsible for themselves. But I know that a lot of my listeners might be listening and have a family member or a friend that they could possibly pass this episode on to. But where can they find you and get in contact with you?
Yeah, easy. So we've got 2 free groups on school. We've got Not Another Rehab and we've got SunMed. So if it's anything for addiction, reach out through Not Another Rehab. Anything clinical that might not be addiction, but probably still is anyway, is SunMed. And they're the 2 communities that we're building up through there. Or you can just go to the website, it's notanotherrehab.com or sunmed.com.au. Easy to find through either one of those.
Amazing. And I'll have those.
Sorry, one more. You mentioned like people reaching out for other people. So it's a big thing. And so one of the things that we're actually putting together is how people who have a family member or have someone who's in the pits of addiction and they want to help them, we're actually putting together a program to help those people because you can't, unless the person actually wants help, you can't help them. And so one of the biggest things, and my family went through this for a long time. My brother was a heroin addict for 26 years, and it wasn't until he wanted to change that it did change. And so it can be a long journey for a lot of people. And so we are putting together that program for other people as well.
Oh, I love that so much. That's so needed. I went through the same thing. Like my mum was an alcoholic for many years. And yeah, you just feel so lost. And it truly has to come from them. And so the family members or friends that are the ones sort of trying to support them, there's not a lot for them out there, like for their support. And it is such a heaviness that they sort of carry with them and the constant anxiety and stress, worried about your loved ones. But feeling so helpless because there's really nothing that you can do. Yeah, that's amazing. I love that. Well done. Awesome. All right. Well, thank you so much. It was lovely to connect, Shane, and thank you to all of our listeners.
Thanks for having us.